Can you hear me? Great. Now then, thank you very much, Grant, for that introduction, and good afternoon, everybody. Now, I remember Vivian Parry, the writer and broadcaster, who has so brilliantly chaired the last two conferences, saying to us back in 2004 that she thought that for any cause there was a time when its moment had come. And she felt that for prostate cancer, that moment had arrived. But she also issued a warning, and the warning was that for every cause whose moment has arrived, there is a window of opportunity to take. And if you miss that window of opportunity, then the moment is lost. And I'm sure that many of you follow pretty closely the media and the public attention that prostate cancer gets. We're all responsible for influencing that level of interest. And broadly, there are going to be three things that are going to make a difference in this battle against prostate cancer. Firstly, determined and joined-up campaigning by all of us who are either affected by prostate cancer or who are directly concerned about it. Secondly, public support. I mean support from the public, from media, and from politicians. And thirdly, a responsive government and a better funded NHS. Now, I think we can say that over recent years there's been encouraging progress in all of those areas. And although we'd like to see it more strongly expressed, there is a general sense that for the cause of prostate cancer, it has been neglected for too long. Something needs to be done about it. So generally the tide is flowing in our direction. But there are a couple of problematic countercurrents that we've picked up just recently, and some of you might have done as well. The first was Professor Michael Baum, Emeritus Professor of Surgery at University College London and a mover and shaker in the breast cancer world, launched recently a tirade against the men's health movement. And in an article in the Times, which was to do with a debate organised by the Institute for Ideas, he had a number of interesting things to say about prostate cancer. He said, I'm going to quote a few points, he would like to give the self-appointed custodians of men's health a bloody nose. They're trying to make men into women. They're trying to whip up the same kind of hysteria about health that bugs women amongst men as well. He says that the endless promotion of awareness about prostate cancer, which is leading more men to ask for PSAs, is especially worrying. He says there's a potential risk of overdiagnosing a latent pathology, which if left alone wouldn't threaten a man's life, yet if detected and acted upon, might threaten his continence and his performance. And he says there's no evidence that this obsession with health improves length and quality of life. In fact, it can only detract from both. Men should ignore these health zealots, he says. And writing in The Sun, Dr. Keith Hopcroft, also having a go at the men's health movement and talking about prostate cancer, said, we docs divide them into tigers and pussycats. Tigers are nasty and kill you, but you don't see them around that much. Pussycats are much more common and just laze about in your prostate, never causing any harm. If you've got a pussycat, you're better off not knowing. If you find out, you'll just end up anxious. You could also end up having treatment with nasty side effects that you might not have needed. He says the problem with current tests is that they can't tell you for sure if your prostate cancer purrs or roars. Add up these facts, and what are you left with? Confusion, no reliable screening tests, lots of ifs, buts, and maybes. Hardly the stuff of a campaign, is it? And then he says, in other words, until we understand prostates better and can stop talking cobblers about testicles, ignorance is bliss. Well, now there's some humour in all of that, but obviously there's a very serious point. And I have no argument with much of what Professor Baum and Michael Hopcroft have to say. I mean, they're simply rehearsing the arguments we already understand about the complexities of prostate cancer. But they offer no constructive solutions. They offer nothing positive. They offer nothing really but a counsel of despair. They show no way forward other than to encourage ignorance, and their message only plays to complacency. Now, the response to those uncertainties can't be simply to ignore the issue, to hope that it's going to go away and that we can just bury our heads in the sand. And that certainly can't be the response of us in the prostate cancer movement. If it were, we would be failing the thousands of men and their families affected by prostate cancer every year. Now, we have a responsibility, those of us working in the prostate cancer movement, to make sure that we get across the message loud and clear that prostate cancer is important, that we need to find solutions, and that it has to become a priority for investment, for care and research, and for government. So we have seen a generally favourable public mood in our direction, but there are a couple of potentially troublesome warning shots that we need to look out for. So what then of the NHS? Well, please, those of you who work in the NHS, the comments I'm going to make are not about you, because it's you who are bringing about the improvements we all want to see in men's experience of the health service in prostate cancer. Now, what I want to talk about is some of the structural and financial issues that you have to wrestle within, the framework that you wrestle with. We've seen several years of well above normal settlements for the health service. The Comprehensive Spending Review of 2002 provided for something over 7% a year on average in real terms growth for the health service up to 2007 and 2008. But the Chancellor has already begun to signal the end of that golden era of investment. And no one here will have failed to notice the pressures that there are on the health service and the daily news reports about closures here, there, and staff redundancies there. We've heard already today about the benefits of specialist nurses and the difference they make to men's experience of their care, helping them in complex decision-making, answering their many queries, and providing support during what can be an enormously stressful and anxious time. The Prostate Cancer Charter for Action, a powerful campaigning group of 24 charities and professional associations, speaking with a common voice on prostate cancer, has called on government and the NHS to make sure that there are specialist nurses in every prostate cancer treatment centre across the UK by the time of the next government. But what's the reality that we face? Over recent months, we've seen many nurses losing their jobs in the health service. And it seems that the vital role of the clinical nurse specialist is particularly under attack. There's mounting evidence that many of them are being asked to give up their roles and to move back to more general ward-based nursing duties. Because of their high level of skill and experience, they're fairly expensive resources for the health service. And they're obvious targets in a financially strapped NHS. And their work dealing with information and emotional support can appear to be less tangible and a relative luxury compared with conventional ward-based nurses. But I really believe that it is a short-sighted and a devalued NHS that fails to appreciate the key role that specialist nurses bring, not only in their direct support for men and their families, but in education, in development of clinical practice, and in helping men to navigate the complexities of the way that health services are provided.